it's always good to, this is my third time in Dublin. When I studied English I started it at the primary school, then my teacher said that, well, if you want to speak real English, you should not go to London, go to Dublin instead. So, but I haven't learned yet the Irish way of speaking, so I have to live with the way I'm used to. Now, I'm going to make a statement, and then I want to see some hands for a morning exercise of you, that these are two desirable goals that many people have in their mind. First, that citizens should be truly in control of their health, and also, in modern days, the data and the system that supports their health. And then that healthcare could, or I think should become an asset, not a cost item for public budgets. So can you please raise a hand who thinks these are meaningful and desirable goals to pursue in countries? Okay, thank you. So I'm trying to tell a story now how this could be done using digital technologies. We do have some similar tough challenges in most developed countries. So financing is not unsustainable. People demand more, and they demand personalized approach to their problems. The growth of health industry shall be data-driven, and what that does, what that has done in any other industry, is it is strongly redistributive, which means that there will be a lot of tension. You know, old schoolboys don't like it, but patient citizens and societies demand that. So we're going to see a lot of that. Healthcare, we know, doesn't fit anymore into existing institutions or locations. And I will start my story by expressing how we in Estonia have chosen to start solving that, at least partly. I know there is no silver bullet that solves all of it, but at least some glimpses how it could be done, and that I personally believe quite a lot. Now, Estonia is a digital society, and what that means, there are just few examples that, well, simple thing, signing digital documents. I think over the last 5 to 6 years, I only sign something on paper when I go to Brussels and have to, file my travel files. I don't do that never in Estonia, ever. Well, that simple part saves me supposedly 5 days a year. Well, I have a busy schedule, so those 5 days would be quite handy with my family, so I really appreciate that. Prescriptions are digital, and 99% of other services are digital. So all in all, it is not only about healthcare in Estonia that people like to be digital, it is pervasive. And many things that we have achieved and that some people have told that they like about Estonian e-health actually have to give credit to things that happened, that started 17 years ago. There was a prime minister at that time, retired now, and he had this vision that, well, we're a small country, we don't have money, and we can't let our ministries to become silos, because then it will be just too costly for us. And then he said, well, I want a system that is capable of making all of them talk to each other. And then we called all the big companies at that time in the world, and they showed their solutions. And in the end, they all had just 2 zeros too much in the end of the offer that they had. So we had to invent it by ourselves. And that's why we have created this weird thing. But over the time, it seems that it kind of works. So what does it take to have this kind of digital society where people really love and enjoy and demand more of it? Okay, lots of information comes from various sources. You need to have information system, technology, which is capable of processing that. And yes, you need to have some people who can make sense of all of this noise with the increasing amounts of data. This part has become more and more important. I've heard that data scientists in Silicon Valley are paid the money that rock stars or sports stars are applying. So really big money. But there's another piece. There's a trust from data subjects. And while I think that the left side of this slide is familiar to all of you, we all come from countries where this is possible. We know that. But yes, I can tell you that this trust part, when talking to my colleagues in other countries, this seems to be something special in Estonia, and it's also not something I hope to prove you, which is, by chance there is a miracle or enlightenment, but it has come over time. Since the very beginning, there has been a very fundamental agreement in the society. Not just health data, but any data belongs to the data subject, full stop. They have access to their data. They can control who uses the data. They can delegate these access and control rights. And there is a very interesting thing that if my data is collected and stored and exchanged at the National Health Information System, I can see who has accessed my data. If my local municipality, I go to ask for some benefits from them, then also makes inquiries for public databases about me, I can see that they have access to my data. There was a case, a situation with me, the situation was 2-3 years ago that I every now and go, there is a public portal I can go and see that a police had made a background check on me, whether I carry firearms, whether I have criminal records, where do I live. And I didn't recall that I had any encounter with the police. And then I filed a request, so what was the occasion? And then I was told, well, 9 months ago you had a speeding ticket. And I said, oh yes, I remember that. It was a small one, they paid it, I had all forgotten that. But it is there, and I can see, and I can control. So basically it is not some government agency who controls, but basically all 1.4 Estonian citizens police the government, how they manage the data. And this is very powerful, actually, counterweight to the trust that we give to the government who provides this service to exchange, even if they don't see and use that data themselves, because the same infrastructure is being used also by private sector. So this is kind of the typical picture of Estonian infrastructure that you see. Well, this is for healthcare, but the similar one you would see if you go to education or internal affairs or wherever. So in the middle, do we have, no, we don't have laser here. So in the middle, we have this secure exchange layer of information, and it's universal. So not only public agencies, but also all private banks, for instance, interact over that exchange layer. And it creates this trust. Basically, it makes certain that if data has started from a hospital and get some additional information from state agencies of medicines and then population registry, that the information that is transferred from one place to another is the same as it started. Nobody has seen it, nobody has changed it. And the originals all stay in their original place. So you don't pull everything together into one place. So we have a decentralized system which also minimizes the risks if something bad happens. And the system has been secure since its building in 2002. There are 6th version just started this year, and there has been no technological breaches. Yes, we have had occasions, for instance, when a doctor, or there was also a notable case when one police officer checked the data of people they were not supposed to. And they got caught, and they lost their job, and the doctor also lost her license. So in the digital world, it's actually more transparent to see what is happening, because you would never know who has access to your paper files. And what it gives from the service point of view is that it's very rapid uptake. So technologically, we have solved that. So now the trust part, not for the society side, but also among the professionals, comes to play. But once it has been agreed, the scale-up is very fast. So Estonia was not the first one to introduce digital e-prescription. Denmark was before us, Catalonia in Spain was before us, but it took them 4 years to get there, where in our case we got in 9 months. From 0 to 80% in 9 months, currently 99% are digital. So this is the power of the solution, that you are very flexible of changing, if lawmakers change the law, or if there is an idea for different kind of integration of services, healthcare, social care. So it's also important to understand that this X-Road data exchange layer, it enables to link, education, your school, your local municipality, primary care and hospital, police to work together, for instance, with kids who are at risk, and if any of them notices that, so they can cooperate together, as said, in an environment where first there is kind of legal mandated monitoring, but also that this part of information that is necessary for them doesn't have to travel by phone calls or by letters, but is actually accessible and usable to all of them. And it's also important to understand that, okay, it comes, with time. The pink line here shows the number of documents or information units that you can exchange between all providers in Estonia. And then the other curves show the usage by patients and healthcare professionals. And, initially there wasn't much information, and everybody was complaining, what's the point in the system? There is nothing, you can't see that. But it's like with fax machine. If you are the only one who has it, you can't talk to others. But once the number of organizations and the number of services, the web services increases, and the ingenuity of people, starts working, different ways of how you can make the data into use arises, and we can see that not only in healthcare but also in other areas, the usage just grows now exponentially. Okay, about the privacy. If there is one thing that we would like to achieve with our presidency over the 6 months period, you can't fix the world in 6 months, is that when people come to Estonia, currently they start a conversation with the question, is it safe? What I would like to get to is that in December this year, the discussion starts not from the question, is it safe, but how can we do it securely and with respect to privacy? So my personal belief, and I spoke with my data protection agency director, is that actually the way Estonia has managed its digital society from the legal point of view since 2001 is based on 2 horizontal laws. One applies to all public organizations, and hospitals are part of that, how they have to manage their systems, and then both the public organizations, but any private organization, also has to follow the Personal Data Protection Act. And what it says in principle are these 4 things. You have to register your data processing, there has to be clear mandate, why you are doing that, what is the content, what are the measures you are taking organization-wise and technologically. There has to be authentication of data processors, so who is actually operating and doing stuff. Everything has to be logged. As said, there has to be a possibility of the data subjects to know what is happening with their information, and then you have to have a monitoring and supervision system in place. So when I asked my data protection officer that what does change with the new data protection regulation. He said, well, you know, we used to have 13 pages of quite well understood and applicable law in Estonia. Now we have 300 plus pages, but in principle, it's the same. It's the same that people have right to know and to control, and they have also right to transfer that information wherever they want to. So privacy in this aspect means that personal data should be not secured from being used, but actually to be used securely. And it is possible. And now about the future, about this conference. By the way, do you know what this is? It's the first stethoscope by Dr. Laennec in France. And it is not that old, actually, it's 200 years old. And it was the first technology that physically separated doctor and the patient. So before that, you know, things were done by hand. If you wanted to hear the heartbeat, you just put your ear against the chest. And I think we should think that technology is not there to separate healthcare professionals and patients, but we should kind of rethink that the main reason people come to see a doctor is not the technology, but this human and social interaction. Now, I consider myself a little bit engineer, so this is the most engineering slide that you're going to see. But what I want to tell with this part is that there are at least 5 important influences that digital will have on healthcare. So there is customization and personalization. So we have smaller and smaller groups that we apply our interventions. There is data-driven discovery. It is not only the 5 or 7 units of information that a human being can process in their mind. There are hundreds, thousands, millions pieces of information that machines can help us to manage and to make sense of that. And then there is a prediction. It is not only, you know, when I went to medical school 25 years ago, too often I saw that the discussion with the patient ended, well, if this doesn't help, come back in 2 weeks' time. Well, this doesn't have to be the case. We are capable of, you know, not forecasting the future, but at least predicting what could be the best possible approach. Then agree with the patient and the health professional, actually a team of healthcare professionals. What is it then that is the patient's share? What can the healthcare system offer? What can primary care doctor offer and others? And then check, you know, have a fast feedback loop, how well we are progressing over that. And then, through improved quality new solutions and improved coordination, there is active patient participation, where again we can use digital technologies to enable that more and more. And then there is location care provision. Care does not have to take place in the physical premises of hospitals anymore. So in Estonia, we are starting to reap the benefits of the system that we have, and I can increasingly see, you know, all the neighboring countries, in Nordic countries, also in this country, in England, in Scotland, in Catalonia. But the Estonian case is that, well, we have 5% of adult population who has donated their blood. We have the genetic information linked now with 9 sources of more than 10 years history for each of them. And then we have investments locally, the government, but also negotiating with international partners, public and private, to test feasibility and value, how this new way of treatment, or actually not treatment, engagement in managing health could take place, what is the ICT infrastructure which is needed for that, and then also to have innovation ecosystem that would help to develop new services, new products, and all this is on the back of this trust. And again, this is real numbers. You can see it's not, you know, linear like the prediction of a startup company that everything will be sunny. So when we started with our Genome Foundation, the trust or support was around 20%, which is enough to start. We are currently somewhere between 70 and 60, and the drop, you can see there are 3 years period, and the drop we understand is mostly related to the fact that we are falling short in providing now services based on that genetic information and linkages to healthcare. So there is increasing number of people who fall into category wait and see, because they want to see that there is active benefit for them. But by and large, people are willing to be part of this kind of exercise where their anonymized information is used for the good of all the other people as well. So the first 2 clinical pilots will be on breast cancer precision screening and cardiovascular disease precision screening for high-risk patients. And well, what I'm dreaming, and here are some examples that I've spotted in other places to make use of this data, is that AI will come. By all means, we already know that radiologists have hard times in competing with computers, but also recent a correspondence letter from the Lancet told that computer-assisted diagnosis of skin cancer actually has reached the same level as at least average dermatologists. And yes, the machines are not yet there, but the trend line is advancing. But the main point here is that the doctors will become obsolete. The main point to me is, well, first, that we can build learning systems. So health systems do not have to wait 13 years of the evidence to become a general practice. So we have CareFlow, where we have all that myriad of information, then we have individualized data, and then we have care decision support algorithms that support. And learning from that feeds back there. And then, with the help of researchers and companies, we can have pseudonymized data, which then enables to develop even more understanding of the patterns of that information that we collect, and that helps again to develop new algorithms. And this is the system that I believe in Estonia, but also, well, in Europe, and why not globally, cross-border countries can work together. And to last 2 minutes, I'm going to show 3 slides about the presidency, what in the digital health we are aiming at. First, to comfort you, I think there are already enough laws, enough regulations. So this is not what we need to do and think, how to force people to do things that are reasonable. Instead, we should make it into practice, share the examples that are there, not only in Estonia, but I know in many countries. Catalonia, for instance, 2 months ago passed a law in the parliament which allows the health data to be used for research purposes. Finland is working in the similar lines. So there are solutions already out there. We can hit the triple aim. There is increased access and safety in healthcare, which can be supported with data. To me, it's a moral obligation to make use of the data that exists there for an individual. Second, sustainability with a value-based approach. We can't decide what is all the list of services that we could or should provide, but we can agree for each individual, because that's kind of a count that we can count. How many people are there we need to take care of? And then agree what is the outcome we want to achieve and what then is capable to us, either technology-wise or even the money-wise. And then new economic opportunities, because all countries around the world would need these solutions. And at the political level, we expect health ministers to agree. We don't know the exact wording, but this is what the governments are currently discussing, to have a council conclusions in December on 2 things: the right of citizens to control the processing of their data, but providing and equipping them with the technology which enables them to do that, and wider use of health data for research and innovation. Again, as a source of economic growth, but also as a source of managing your health systems better. So I hope I could convince you at least a little bit first that these goals are desirable, they are achievable, and to conclude, I personally would like to convey you the messages that citizens should be in full control of the data. Data integration is the engine for economic growth, and digital single market in Europe should and could be put into use to the benefit of all European citizens. So this astonishing way of doing things is do them safely, but be bold. And you're all welcome to Tallinn in October 16 to 18th for a Digital Experience Health Conference. Thank you.